Dr. Balaji, the gastroenterologist and hepatologist. So today I'm going to talk about the most important and most common disease in the world, that is fatty liver. In turn, the non-alcoholic fatty liver, which is common among non-alcoholic patients. Why I'm talking about this is this has become most common and emerging disease and a silent disease in the world. Now, what is fatty liver? The fatty liver is nothing but excess of the fat gets deposited in the liver, and the liver cells become swollen, makes it liver appear bigger. That we call fatty liver. And in patients with who are not alcoholic, we call them as non-alcoholic fatty liver. That is NAFLD. And yes, among the non-alcoholic fatty liver, there is two spectrums of the disease. One is simple fatty liver, next is fatty liver with liver damage, that is called non-alcoholic steatohepatitis. And what is simple fatty liver? In a simple fatty liver, there is only swelling of the liver without liver damage or without liver inflammation. And this doesn't require any treatment. Whereas the other spectrum non-alcoholic steatohepatitis, where the liver is swollen as well as there is inflammation, ongoing inflammation, that is liver damage which is happening in the liver, that we call non-alcoholic steatohepatitis, that is NASH. And why this is important is the non-alcoholic fatty liver, that is NAFL or NASH, is the commonest cause of chronic liver disease in the Western world as well as among India, which is comprising about 25 to 30% across the globe. So since it is the most common cause of chronic liver disease of late, we should create awareness about this fatty liver disease so that early diagnosis, early recognition and early treatment will definitely reverse from fatty liver to normal liver. Now next, what now leads to non-alcoholic fatty liver? Since I told it's among non-alcoholic, mainly obesity, diabetes, hypertension, hypothyroidism, and sedentary lifestyles, and eating all refined foods, mainly our diet style, refined things heavy non-veg intake and all kinds of sugary drinks or aerated drinks, which will get converted into fat and gets deposited. Okay, these are the causes for the fatty liver. Next is, what are the symptoms? How do you diagnose this fatty liver? 90% of the times, not 90%, almost 99%, the fatty liver is completely asymptomatic. You will not know, which will be diagnosed or detected on a routine health check. Whereas in the patients with non-alcoholic steatohepatitis, where I told inflammation or damage, those patients, small subset of patients, they can have some amount of fatigue, that is called lethargic, or rarely they can have right upper quadrant pain because of the swollen liver. So these two are the most common symptoms of NAFL or NASH. In case if it gets converted into liver cirrhosis, then symptoms are entirely different, like jaundice, water accumulation in the stomach, all those things will happen. But overall, the symptoms are only fatigue and abdominal pain, which are again rare symptoms, the most common being asymptomatic among these. Now next, how do you diagnose this fatty liver? Diagnosis simple means by doing ultrasonography to know what grade is the fatty liver, and that the blood test liver function test, mainly to see if the liver is getting damaged so that it goes in different spectrum like NASH, or liver function test, if it is normal, it goes into simple fatty liver. And next is to check diabetic, hyperthyroidism, cholesterol, all these things which may contribute to the reason for the fatty liver. And the least will be is the fibroscan. And the fibroscan is nothing but non-invasive test. It takes 2 to 3 minutes to 2 to 5 minutes to get the result, which gives how much the fatty, what is the grade of the fatty liver. Also, it gives about the stiffness of the liver, which in turn we can diagnose, or we will know, we can prognosticate about the fatty liver disease. So these are the tests like ultrasound, blood test and the fibroscan, which helps to know the grading or degree of the fatty liver, and it also helps in the prognostications. And the last is how do you treat? Does all the fatty liver requires treatment? Yes, but not medical treatment, all the fatty liver. But the most important is diet and lifestyle modification, which are the vital and utmost importance. And these also will be sustainable treatment for the patients with fatty liver. I'll tell you, diet means need to avoid all refined foods and even refined oil. Try to get cold pressed unrefined oil which contains polyunsaturated fatty acid which is good for health. And you have to cut down all refined drinks like all these sugary drinks, and reduce the calorie intake if you are obese or diabetic person, so that the extra calories will not get converted to fatty liver. And apart from diet, next most common important thing is physical activity. That is exercise which is utmost important. Physical activity in the sense at least 30 minutes a day, regular running, jogging, or some kind of sports with aerobic kind of things. At least 30 minutes you have today, at least 5 days a week. So maximum at least 120 to 150 minutes of an exercise is required to maintain a good physical activity, so that it helps in reducing the fatty liver. So these two diet and lifestyle modification are most important, and maintaining this will definitely reduce us from fatty liver to normal liver. And least will be medical treatment medications, drugs, not to reduce fatty liver, but in case along with fatty liver, if there is inflammation or damage going, there are some drugs which can reduce the inflammation for certain period of time along with diet and lifestyle modification. So friends, this is about the fatty liver thing. In case if you have more queries, or if you want to know more details about me, you can contact us. And please you take care of your liver as you take care of your heart and other organs, because liver is most important organ in our body, like any other organs. Thank you.